I'm mainly going to do a review of the Evolution knee system. We've got 7 to 10 year follow-up now. I do have disclosures. The advanced medial pivot knee was introduced in 1998. The medial ball and socket design was mainly influenced by the work of Dr. Freeman, Dr. Pinskarova, Dr. Blaha. I think we should probably mention Ann Hollister and others. And we do have some long-term data. It'll get presented later today. But survival analysis showed a cumulative success rate of 98.8% at 17 years. In terms of function, Dave Backstein's group compared his group of PS patients that were done earlier in his career with a second group of medial pivot patients. And when he looked at the forgotten joints score, he saw a significant difference between the two groups. The Evolution knee was introduced in August of 2010. There were a couple of modifications, and that's really the purpose of this study, was to see how these modifications, did they affect the clinical or long-term outcomes. So one of the modifications of the poly locking mechanism was the offset of 15 degrees rather than going straight onto the tibial base plate. It's much easier to put in at that 15-degree offset. We did shift the dwell point a couple millimeters posteriorly on the medial side, and we also reduced the poly thickness on the lateral side posteriorly. So our hypothesis was that these changes to the Evolution knee design would not have any deleterious effects on the radiographic or clinical outcomes. So I looked up my patients, started in December 2010 through October of 2023. We identified 778 patients who underwent a primary knee. We had 308 lost to follow-up, leaving 470 patients in our study cohort. 152 of those patients were by phone interview only, and we had no radiographs within the last 1 year. Our age was typical, as you see here, 62 on average. We had 203 males, 267 females. Our BMI was typical for Middle Tennessee, 31 with a range of 20 to 50. Our diagnosis was mainly osteoarthritis. 284 of the cases were unilateral, 93 were bilateral. I'm a patella resurfacer, so almost all had a resurfaced patella. I'm a cementer, so 100% were cemented, and I'm a PCL sacrificer, so 100% were sacrificed. Don't care for that ligament. In terms of our results, when we look at our forgotten knee score, the specific questions on walking on level ground, 61% of our patients reported never or almost never, feeling like they had a arthroplasty on that side. Climbing stairs, we were almost 50% at never or almost never. And our forgotten joint score average was 67 for these patients in the 7 to 10 year follow-up. And that's similar to what Dave Backstein reported in his study. We did have a few complications. The typical, we had 4 infections, 3 late, 1 acute. This is an x-ray of the patient with the acute infection. He had IND with a poly exchange at 3 weeks post-op, and here he is in 9 years later in 2021. We had 4 traumatic injuries, 1 posterior capsular release, which required just an exchange of the poly, thicker poly. We had 1 partial quad tendon rupture that you can see on this x-ray. It was actually happened 4 years after surgery. She underwent a quad repair, and then here she is 6 years later, still doing fine. We had 1 MCL rupture, 9 years post-op, and 1 patella fracture, 6 years post-op. We did have 2 late hemarthroses. I don't know if anybody else is seeing that in their practice. The first one was this patient shown here in 2014. The first one actually was a recurrent hemarthrosis that happened at 7 years post-op, and this was after starting Eliquis for AFib. and she underwent an IND, synovectomy, and poly exchange and had no further sequelae. This patient shown here is the one that had what I call an unexplained recurrent hemarthrosis at 1 year post-op. Infection workup was negative. Again, underwent an IND, synovectomy, and poly exchange, and seems to be doing well. We did have 4 revisions, so 4 of those 470 were revised. So we have a 99% survival rate at 7 to 10 years. 3 were revised for instability. 1 required a CCK insert. 2 of the revisions, we put a thicker poly in, and there was 1 femoral component failure, and it was a isolated single component revision. Here's the instability patient that required the conversion to a CCK. Index procedure was in 2012 on the right. In follow-up in 2021, she was hyperextending about 15 degrees and had some moderate varus valgus instability, but the hyperextension was the problem. And I converted her to this CCK design. I'm showing this case. It wasn't in our original cohort, but I do want to show this. This was a lady that had surgery, I think in about 2009, 2010, early 2010. And later in life, at 9 years, she came back to me and had this same instability, hyperextension, a little varus valgus instability. And I went in, just put a thicker liner. I think she was a 10 millimeter insert on the one on your, the index surgery on your left. And then you can see the interval x-ray, you can see the thicker liner. And then ultimately she failed and required a hinge. And she also had some type of connective tissue disorder. She had some surgery on her lens for some issues with connective tissue. So that was that patient. The femoral component failure happened at 9 years. Here's his index procedure. You can see in the middle at his follow-up in 2021, there's a, if I can do this, there's a radiolucency under the condyle. We did an infection workup, which was negative. I went back in and revised him, and this is his latest x-ray in 2022, so we have a 1 year follow-up. So in conclusion, I think the medial pivot, evolution medial pivot knee has demonstrated similar clinical and radiographic results as the advanced medial pivot knee, despite the minor changes in locking mechanism and polyethylene shape. And I would just add that, I don't know if it's ever been specifically stated, but I would say that any medial pivot knee is contraindicated in a patient with a connective tissue disorder or excessive laxity. Thank you.